This video is going to be the hamstrings. So we're just going to get started right away. Page 311 in your book is where this begins. So we're going right into the hamstring group. And as I had mentioned in the previous video, the hamstring group is on the posterior femur here. Trying to get this straightened up there. Okay, posterior femur. However, the hamstrings are actually a lot smaller than most people think they are. Whenever someone takes a look at the hamstrings in a book or on an image, it looks like it's mostly the posterior thigh and that it takes up a lot of space on the posterior thigh, but that's simply not true. The hamstrings are actually quite small compared to the adductors and vastus lateralis. So I'd like to try to give you an accurate picture of the hamstring muscles here. By the way, does anybody know why our posterior leg muscles here are called hamstrings? If you read ahead in your book, you know. It's actually on page 311. Yes, the term hamstring actually comes from a time, and I guess maybe some places still do, when butchers would hang pigs up by the tendons of their posterior leg for display in their windows. They were called the hamstrings. They'd string the ham up by those posterior tendons. So that's where we get the name of these muscles, actually. That's an interesting thought. All right, so we actually have three muscles here. We have biceps femoris. Biceps femoris has two heads, so it kind of looks like there's four, but there's really only three. Biceps femoris, and then the semisisters. Semitendinosus is the superficial one, and then semimembranosus is the deeper of the two. So as far as origins are concerned, they all originate on the same landmark. What is this? It is the ischial tuberosity, that is correct. So the common origin for the hamstrings is the ischial tuberosity here. Okay, and then they're going to insert on the tibia and fibula, because as you can see, their tendons make a pretty sharp diversion from one another around the popliteal space, and then insert on the tibia here and fibula here. So let's take a look at the official origins and insertions. All right, so for biceps femoris, we have two heads, so we have two origins. The long head, which is this one right here, or this one over here, whichever you prefer, that's going to originate on the ischial tuberosity. As I just mentioned, the common origin for all the hamstring muscles is the ischial tuberosity. However, you also have a short head of biceps femoris, and that one originates on the lateral lip of the linea aspera, okay? Right next to vastus lateralis, although not as large, of course. So right there, okay? Those two heads. Now, the insertion for biceps femoris then is going to be the head of the fibula, because this one is on the lateral side of the leg. And you recall, just dropped my tibia. When I put these two together, the tibia and the fibula was on the lateral side. Now, I know it's hard to visualize because you're facing these, but imagine these in your body. So this would, the bottom of the tibia would be your medial ankle bone, and the bottom of the fibula here would be your lateral ankle bone. So the fibula is the more lateral of the two bones. So we insert on the fibula, specifically the head of the fibula, which is this bit right here, head of the fibula. Okay, so origin and insertion, not too bad, right? 2 origins, 1 insertion. One of those origins is actually a common origin. So as far as pieces of information are concerned, this one's actually pretty easy, pretty small. The actions, on the other hand, are a little more complex, and that is because we cross 2 joints. We cross the hip joint here, we cross the knee joint here. So we're going to have knee and hip actions. All right, so we do flex the knee. It's a hamstring muscle. It's on the posterior side of the leg. It can flex the knee. And we can laterally rotate the flexed knee. Now that's a little harder to visualize. I have mentioned this before when I was trying to show it on the skeleton back there, but he's got a metal thing through the middle of his knee and it didn't work out real well. So let me just show you here. So let's flex the knee, which would look like this, okay? And then lateral rotation of the flexed knee goes like this. Okay, so the tibia actually rotates a little bit right where it is. Not too much, mind you, because we have ligaments right in the middle here, right in between these 2 bones that actually prevent this from happening to excess, you know what I mean? But you can laterally rotate the flexed knee just a little bit, okay? That's what that looks like. And that kind of action is more for pivoting when you plant your foot and you pivot, like when you're changing directions quickly, that's when you do that lateral rotation and medial rotation of the flexed knee when you're changing directions. All right, so flex the knee and laterally rotate the flexed knee, okay? Now, we have hip actions. So this is all long head, of course, because the short head does not cross the hip joint, as you can see. It's too little. All right, so the long head extends the hip. Well, sure, that makes sense. We're on the posterior, so it's going to do posterior things. Extension is a posterior action, right? So extends the hip. Now, it can also assist to laterally rotate the hip. It's not a strong lateral rotator. Obviously, you have the glutes for that, but it can assist in lateral rotation of the hip, okay? So we have 4 actions. We have 2 at the knee and 2 at the hip for biceps femoris. Moving on. All right, so here we have the semi-sisters, semitendinosus and semimembranosus. Semitendinosus and membranosus are synergists, okay? They are in the same spot, essentially, and they do the same things. Semitendinosus is the more superficial of the 2. Its origin is the ischial tuberosity because they all originate at the ischial tuberosity. And its insertion is the proximal medial shaft of the tibia at the pes anserinus tendon. What other muscle that we have studied also inserts at the proximal medial shaft of the tibia at the pes anserinus tendon? Yep, gracilis. That's right. There are going to be 3 of them. So this is the second one. So we had gracilis and semitendinosus so far. There's another. I know, I'm keeping you in suspense. All right, so we have ischial tuberosity to pes anserinus. And as far as actions are concerned, these are basically opposite of biceps femoris. So antagonistic to biceps femoris, because instead of inserting on the lateral portion of the knee, it inserts on the medial portion of the knee. So we're going to have more medial type actions. First and foremost, though, it is a hamstring, so it does flex the knee, okay? But look, now we have medial rotation of the flexed knee, okay? Instead of lateral rotation of the flexed knee like biceps femoris, we have medial rotation of the flexed knee. These are actually really easy to remember because semitendinosus inserts medially, biceps femoris inserts laterally. So the actions kind of follow where they insert. So we have flexion of the knee and medial rotation of the flexed knee for semitendinosus. And then, of course, we have some hip actions as well because we do cross the hip joint here. So we extend the hip because we're on the posterior, we're going to have extension. And then assist to medially rotate the hip. So here are medial actions here. Medial rotation of the flexed knee, assist to medially rotate the hip. Okay. We have one more action that all of the hamstring muscles do, though I'm not entirely sure why it wasn't listed on biceps femoris, and that is to tilt the pelvis posteriorly. So if you recall, the anterior tilt takes the ASIS, which would be my fingers right here, and moves them towards the floor, right, on the anterior, down that way. And the posterior tilt of this pelvis is the opposite. So we're actually setting the ASIS back a little bit further, and the PSIS then would actually kind of go towards the floor. That's what these can do. They actually pull the pelvis into a posterior tilt when they are really tight. Now, I haven't mentioned nerves very much up until this point, but look, they are innervated by the sciatic nerve. When the sciatic nerve is pinched or compressed or it has some kind of lesion on it, the referred pain pattern goes down the back of the leg, and that is because those nerves extend down the back of the leg through the hamstrings and then usually down, starts branching off at the lower leg and then down to the foot. But the hamstrings are very much involved in sciatica, not because they can cause sciatica necessarily, but when the sciatic nerve is yelling, for lack of a better word, the hamstrings start to contract as a result, okay, and they start to get tight. And you'll see this, people who have sciatica or even pseudo-sciatica, their hamstrings on that side will be really tight. And that's something that you can work on. All right, so moving on to semimembranosus. Semimembranosus is the deeper of the two semi-sisters. It has a little more tendon to it. It's kind of an odd shaped muscle. Origin is the ischial tuberosity here. Insertion is slightly different. It is not the pes anserinus. I know you were hoping, but it's not. It is the posterior aspect of the medial condyle of the tibia. So what we're looking at here is the medial side, so medial condyle. These are actually condyles. The tibial plateaus are just the top part here. These are big fat condyles. So if we spin this around, we're talking about right here. Posterior aspect of the medial condyle of the tibia. So right about in there. All right, now as far as the actions are concerned, remember the semi-sisters are synergists, so we have flexion of the knee, medial rotation of the flexed knee. We have extension of the hip, medial rotation of the hip, and tilting the pelvis posteriorly. So the actions are identical, okay? Also innervated by the sciatic nerve. So other than the insertion, semitendinosus and semimembranosus are identical muscles. All right, so let's take a look at this here. The hamstrings as a group, right there they are. See, they are rather small. On the medial side here, you have adductor magnus. Remember, adductor magnus is the floor of the adductors. It is the most posterior and the largest of the adductors. So on the posterior side here, this is adductor magnus that you'd be palpating. And then some of the other adductors higher up towards the groin area. On the lateral side, it's vastus lateralis. All of this over here is going to be vastus lateralis, okay? If you go too far over, too far laterally, let me just move this up here. I just want to show you the whole thing for a second. There it is. Okay, if you go too far laterally, you're going to run right into vastus lateralis, see? Because it covers the whole lateral thigh and part of the posterior thigh as well. All right. So let's take a look at these. I'm going to turn this guy around. There we are. Okay. So again, here's vastus lateralis, right? It's a whole lateral side. Here is adductor magnus. Okay. And then, oh, I'm in the way here. Oh dear. You know what? Move me out of the way. There's adductor magnus, sorry. Okay. Adductor magnus, and this is semimembranosus, sorry. Okay. These are a lot skinnier. It's hard to get my bearings sometimes. All right, so this one's adductor magnus. It's got the large origin here. And you can see if I take these off, it goes all the way across here. Yeah. So again, on the medial side, there's adductor magnus. So here is biceps femoris. Okay, that's just the long head. Of course, the short head is covered by the long head. Here's semitendinosus right there. And then semimembranosus deep to that. We can take a look at some of the actions here, right? We have related content. You can just click on that. Ta-da! And it shows you the actions. So these are shortening, producing flexion of the knee. That's right. Flexion of the knee. That's pretty cool. I love that. But see how small they are? They're so tiny. And look, that common origin on the ischial tuberosity, they just go straight down the posterior thigh. And one thing I do want you to note here is this division between the semicisters and biceps femoris. This area right in here has a tendency to get stuck together. Little fibers form in between those two, and it can be quite tender in between those two semicisters and biceps femoris muscle groups. So I'm going to pause this for a second. So I also want you to see these tendons. These tendons are significant. They're thick and they're big. So these are the tendons that you can palpate very easily on the posterior thigh down near the knee. These are the ones that you know, you typically have to be careful when you're shaving because it's easy to nick the skin there where those tendons really pop out. Okay, so if you're sitting here watching this video, not on a couch or, you know, someplace where you're actually sitting up, you can just feel the posterior thigh down near the knee and you'll feel these tendons right away. Okay, they're very palpable, very superficial. All right, one more thing. Because we're talking about the sciatic nerve, these are all the nerves and blood vessels that run through this area, and these green things here are lymph nodes. So I'm going to turn them around here. Where's the sciatic nerve? Can anyone tell me where the sciatic nerve is? Yeah. This very large gold thing right here is the sciatic nerve. You can see how big it is, how significant it is to that area. You have lots of branches of this. However, I guess I got to zoom back in. It pretty much is solid down the posterior thigh here. Okay, so innervates the semicisters through here, all right? And then it'll start branching off a little bit later. But as you can see, there's the greater sciatic notch. Not a shocker that the sciatic nerve goes through there, but you also have blood vessels and things that run through there as well. Okay. And of course, all of this is deep to the musculature there, except for where you see these exiting nerves. These are going to innervate the gluteals. Okay. All right, so that's it for the hamstrings. Next up is tensor fascia lata and sartorius. Stay tuned.